I am Tina Ann Thompson. I'm a family doc for the last 16 years. I'm going to talk today about stress and aging because, as we all know, that we can affect our skin, but one of the things that we really need to address is the inside, and specifically up here. So what is stress? Stress is the external stimuli that are troubling to us. So they're physiological responses to stress, and then there are responses that we don't really quite understand. But we do know that there are a few people that are particularly at risk, and I'm sure no one in this room is like this. These are the anxious folks. They're super reactive. Something happens, there's a noise, and all of a sudden you see a reaction in those folks, both physically and emotionally. We can also even tell some of our patients, they'll get their blood pressure. I hear all this white coat hypertension. I'm like, really? You know me. I'm cool. Why do you? And I don't even wear a coat. But their blood pressure is high, the pulse rate is high. As soon as they go home, check it at the Publix, everything's fine. There are also these type A personality types. Again, no one in this room, no physicians, no nurses ever. The type A personality helps us in some ways, but in some ways it harms us. So yes, we need it to, go through medical school, go through nursing school, go through all of our careers, but there are also some traits that we have that are not quite helpful. These are the folks that really need a lot of power. They don't really need a lot of relationships in order to, and they don't feel the need for relationships, though they actually probably do. There's some behavioral changes that we notice, that we see when we're stressed. Sometimes our patients see it, sometimes their loved ones see it. Their aggressive behavior, they're avoidant. The physical symptoms we talked about before, they're just hyper aroused. One of the things that I see quite a bit in my family practice, taking care of patients who are in the 6th and 7th decades of life, they come and they say, oh, my memory is not so good. Okay, well, tell me what's going on around you. And then I'll find out that the kid moved back home or whatever number of stressors they have, and all of a sudden they become forgetful. I do my mini mental status exam, and they're totally fine. They just feel really forgetful because of all of the stressors going on in their lives. So there are a bunch of sources of stress. We're not going to call them all out because we can all say what they probably are right now. For me, it was getting all the way to Greater Atlanta Christian School tonight, picking up my son, and then holding my breath that he had a good day, because if you guys know 12-year-old boys, it could be anything. I could have got detention for calling out an answer or any number of things, tackling a kid on the playground. All those things have happened. It could be the stress of the holidays and changes in family. My mother-in-law was here today, and we just lost her husband, my father-in-law, and my patient was in here who'd also lost her husband. And so changes in the family dynamic, changes in our homes. When the children move out, I know I'm going to be freaking out. If they have to come back home, I'll probably feel the same way. I'm not sure, but probably. Changes in employment and conflict. Hopefully, again, these changes are things that stress us, but we don't internalize some of these things that we really just don't need to make affect our health. Things like our environment, these things also stress us. Overcrowding, if our physical plant that we're in at that moment is not ideal for us. Then the emotional pressures. These are some traits that a lot of us have, where we worry, we try to be perfectionists. I discussed this morning in front of my mother-in-law, totally forgot that she was here at the time, but my father-in-law was giving us premarital advice. He married us. And my husband had this list of expectations for marriage and for me, and I was supposed to have my list for him. And his list was so short. Like, he literally had the lowest expectations for a wife that I have ever seen. And so I thought, for that moment, he really doesn't expect much from me. But I expected everything from myself. I expected to be a size 0 and do residency and have a kid and have dinner on the table and every number of things that women think that we have to do. And he really did not care about any of that. He's like, babe, I can stop and get something. It's okay. No big deal. And you know they say that, and you're just like, but you don't mean it. Yeah, they do. So there's some results of stress, and you're probably like, okay, we're supposed to be talking about skin today. When is she going to get to that? And there's a bunch of results of stress. So physical responses like angina, which is chest pain, asthma. A lot of us will overeat or undereat. Headaches, painful periods, no periods. You know, the hormones go completely out of whack when we're stressed. Insomnia, these are just all some of the results of stress. And if you wonder again why I'm talking about stress at a med spa, it's because of this, because our skin stresses as well. And so if you remember the presidents, and hopefully we all remember these guys, Daddy Bush aged the worst. I mean, this was totally awful. And I told the folks told Chrissy this morning that if I became president, which would be totally possible, she would have to move into the White House. We have a plan. So she would move into the White House, and I would get over my issues with needles. We'd bring the Pronox, and I would be totally fine. And then I would not be on this screen. I'd be on the screen as like what you can look like after Chrissy. So psychodermatology, my husband is a psychiatrist, and so we talk about these things quite a bit, actually, about the effects of stress on the skin. There is a few things like acne. Those things can be stress-related, not always. Atopic dermatitis like eczema, things like that. And then psychogenic purpura. These are things that pop up on our skin when we're stressed. Rosacea, not all rosacea is stress-related, just FYI. And not all seborrhea, which is the little scaly stuff, the little dandruff things that we get in our eyebrows. Not always stress-related, but can be. Hives. Hives are huge when we're stressed. Very, very, very common for just random hives to be related to stress. Not always. Sometimes it's actually something that we're allergic to. Could be allergic to getting married to some guy you shouldn't get married to. And so you break out. It totally happens. Not to me. And then parasitosis, where we feel like something's crawling on us and it actually isn't. Or pulling our hair out. Dermatitis artifacta, this is when we're itching. And so we itch, and then we scratch. And then we get into this itch-scratch rotation. And so I've seen patients that their skin is completely leatherized because of just scratching constantly. And they really, truly feel like it itches. There's treatment. And picking. I didn't mention the picking. That happens. Some of us will pick at the least little thing and continue to pick until it bleeds and gets infected. Again, stress-related. See, it happens. It totally happens. I'm not making the story up. So how do we manage all this besides just don't pick, don't scratch? Really, Tina? That doesn't always work. One of the things that I want to spend the rest of the time talking about actually is helping us to create our mission, our mantra. We had to do this a lot in residency when you are 26 in medical school, when you're 26 years old and you're watching people die, you're watching people at the end of their life, you're watching people give birth, you're watching all of this stuff. You start to wonder, like, why am I here and all of this? And we were told, and we still continue to do so, I make my husband do this every 5 years or so, write down our mission, our purpose, because it helps to center and focus us. And then, we have certain gifts. I wanted to be a supermodel, but I'm 5'2", so it's not gonna happen. So I utilize my gifts. So developing our mission based on our purpose, our values, and our gifts, and then figuring out how to carry out that purpose. Setting goals, time management. I strongly believe in setting long-term goals, short-term goals, daily goals. My daily goal today was to have about an hour time with my son, and I did, because I don't get to, he doesn't talk to me one-on-one. If his dad's in the room, he just talks to his dad. So I try my best to get some time with him in the week, time that he's not going like this on his phone or any number of things. And that was my goal today, and I accomplished that goal, so thank you for allowing me to be a little bit late today. Prioritizing. Once you figure out what has to get done, that hour for me had to get done, what needed to get done, and what I'd just sort of like to get done. I'd have loved to got to the dishes. I didn't. I wasn't going to miss this for the dishes. And scheduling, we really need to figure out, the Google Calendar, whatever it is, just figuring out the schedule. Again, today's event was not on my family schedule, so my husband is like, well, where are you going? What are you doing? What do you mean I have to pick up Nyla? Yeah, you got to pick her up. Delegate. Get it done. Asking for help. This is really key. Anything that you don't need to do, anything that you can pay someone to do, anything that you can barter with somebody to get done, let somebody else do it. They probably can do it better. I know I don't fold my laundry very well, so somebody else has to do that. Eating a balanced diet. And when I say balance, I really do mean balance. Being totally with an elimination diet when you don't have a particular allergy or something is really not all that helpful. If you're not allergic to the piece of chocolate, I loved it when Weight Watchers came out with those little bites. They're so cute. Or, whatever it is, just enjoy a little bit of it. Now, when I say balance, we're minimizing coffee. 1 cup-ish a day is plenty. Any more than that, thinning bones and graying teeth and all kinds of stuff. We really don't need that much. So just, a little bit of coffee. Absolutely, positively no nicotine whatsoever. That just raises your cortisol level and just no good for you. And we've got to sleep by whatever means necessary. 4 hours of sleep, not enough. All these people who tell me they can survive, I don't need sleep, I'm good. Yeah, you do, though, because you need sleep for memory. You need sleep for reducing stress. You need sleep because, we're supposed to sleep. Like 1 out of 7, you're supposed to be completely out of sleep. Again, we need to stop smoking. This aerobic exercise, I want to just touch on this. This is what the book says, but this is not reality. 30 minutes, 5 to 7 days a week, I still gain weight. So I don't know why it says that, because it's not true, but that's totally what the book says. I think they're just talking about heart prevention and stuff like that. But you'll totally gain weight if you only exercise for 30 minutes, 5 days a week, if you're 40, 50, 60, or 70, or 80. Maybe if you're 90, it's okay, but it can't happen. So I strongly recommend finding something that you love and doing lots of it. Back to the balance again. Just running, no good, you'll blow out your knees. Just yoga, no good, you need a little bit more cardio and such like that, unless you're doing that hot yoga or that super fast yoga. But just doing something every day for about an hour, we have time. We've got to make the time. We've got to prioritize. Playing. That's kind of fun. Just play. Raise your heart rate up a little bit. So again, back to the lifestyle management, having that positive self-esteem. This is huge. I'm a good Christian girl from the Northeast. I don't know, I'm supposed to be Southern values and all that stuff, but we really need to accept ourselves as being valuable because we were created in the image of God. And so when I hear folks and they're just really down on their self-esteem, and I'm thinking, didn't your mom tell you how special and fabulous you were? And sometimes she did, and you believed her. And sometimes she didn't, and sometimes she didn't exist. So if no one told you how special you were growing up, like my mom totally preached, I'm telling you, I thought I was going to be a supermodel. She told me I was the most stunning thing on earth, and I believed her. And then I realized that, in Sunday school, that I was created in the image of God. So this one really hurts my heart when I hear folks and see folks who don't truly love who they are. Having social support, it's so easy to not have a lot of friends as we get older. They just seem to wander away. All of a sudden, the friends from school, soccer, church, wherever, we just seem to grow distant. We've got to force ourselves into some sort of relationship because that's how we were designed. We were designed to be in groups. Monitoring our stress is really key. A lot of times I'll ask patients, so are you under any stress? And actually, in the last few years, all of our academies, including the pediatricians, have decided that we need to, as primary care physicians, need to ask about stress or mood twice a year at the age of 13 and up. 13. That's because 13-year-olds are stressed, and 33-year-olds are stressed, and 53-year-olds and 93-year-olds are stressed. Everyone is stressed, and we really need to know how to approach you. So you should be getting asked twice a year. If you're not getting asked, please tell your provider, hey, you forgot to ask me about my mood, and this old doctor told me that you're supposed to. They probably are. So again, back to becoming aware that we're getting stressed is really key. One of the things that really helps with stress, again, is exercise, and I just use a quick little plug for my kid doing his exercise. Just love it. I know, it's so adorable. Oh my gosh, but thank you. That's what I'm supposed to say. So help is available. This is not a plug for my husband. Help is totally available because he's a child psychiatrist and none of you need that. We need to seek medical attention when these things happen, when we feel out of control, when we're having chest pain, because chest pain is not necessarily stress. Chest pain could be your heart, palpitations, shortness of breath. If a pain is not being relieved by massage therapy or anything like that, we've got to come in. One of the things that I learned in school, they said, oh, your patients will come in and they say, oh, this is happening because I'm getting old. They said there are only a few things that are supposed to happen when you get old. Your hearing is supposed to not be ideal. Your vision is not supposed to be ideal. Your hair should gray if you let it. And you should, and I always spell this one, W-R-I-N-K-L-E. And we've already talked about all of those things. So we shouldn't really have pain, and we really shouldn't have forgetfulness, and we shouldn't have all these other things that everyone says, oh, it's my age. No, it's not. If your gut tells you that something is not quite right with you, please, I encourage you, if you're not a hypochondriac, talk to your doctor about it. And push till you get an answer. I love medications. I really, 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 really love medications. I should be speaking for all of the companies who make medications for anxiety. And may I say, the people that the medications are for are not necessarily the person taking the medication, but the people who live and work and parent the people who need the medication. So please let me just give another plug for medications. If you have to take a medication, it is not a sign of weakness. It's not a sign of that there's something particularly flawed with you. It's just a matter that your chemistries need to be aligned, and medications are great. Now, I also don't like medications because I think that we should just survive on water, and that's fine. And so there is room for that. May I just say that 30 minutes of exercise is supposed to be equivalent of 20 milligrams of Prozac, which is for fluoxetine, which is an antidepressant. So yes, Prozac is great, exercise is great, both together are phenomenal. Anti-anxiety medications, another plug for this one too, and sleep aids. I don't love sleep aids. Everybody knows why we don't love sleep aids, all the side effects and everything like that. But if you're not sleeping, we need to get sleep. By any means necessary is what I say for sleep. And wine is fantastic, but does affect our sleep pattern. And so, again, did I talk about balance? Yes, I think I did. Therapy, I also love therapy. So exercise, medication, and therapy, oh my gosh, you're golden. So loving the group therapy. It reminds us that we're pretty not uncommon and abnormal. First got married, and I thought my husband was weird. I mean, he left his shirts everywhere, and he wasn't super sensitive, and I was like, gosh, what's wrong with him? And I've made this big decision. And then my friends started getting married, and they started having the same types of husbands, and I was like, oh, they're supposed to be like that, you know? And then I told him what I actually needed. I said, hey, I need you to do X, Y, Z, because I learned that in some of these books that they teach you, and you speak up. But when you're young, you don't speak up. And then finally spoke up. I said, I need you to do this, because this meets my needs. And there it was. Again, you can't get that by yourself. You get that from therapy. You get that from being in relationships and being in groups. These group therapies can be religious-based. They can be individual. Sometimes we need some inpatient therapy. Hopefully we catch you a little bit before that. But if we need to catch you inpatient, please don't hesitate to go. These folks are the folks who do some religious therapy, and they call this cognitive restructuring. I have a few therapists who I work with that do this. They talk about developing that positive mindset. This one's tough. This one you're not just going to get from a talk about aging. This one you're going to have to just put in some serious work with the therapist, because they have to completely change the mind of someone who thinks that When I go outside, it's actually dark because bad things are going to happen. There are people who actually truly believe that bad things are around the corner, and they don't even know it's around the corner. And if that's you, just, go get some cognitive restructuring. It totally works. Problem solving, getting some group help to help us figure out how to solve your problem. Sometimes we got to take a little step back, look at the bigger picture, write the story down, and somebody else can give you a little bit better idea about problem solving. We've got to forgive, and we've got to deal with unresolved issues. This one's tough. Every time I go to church, I write the same name down when they talk about forgiveness, the same person that I still haven't forgiven. It's so hard, but we have to do it. We totally have to do it. And I write his name down, which means I really still haven't forgiven him, but you totally have to. But, I'm doing the talk. So having a sense of humor is huge. That's how I deal with a lot of the stressors. That's how my husband deals with it. He can tell a joke at a funeral. It's so weird, but that's how he deals with stress. My son does the same thing. And I watch him in a stressful situation. I watch him giggle, even when I'm disciplining him. And he's not being disrespectful. It's just his way of that nervous laughter dealing with his stress at that time. Initially, it drove me crazy, but having understood a little bit better. And then having assertive responses. This one, I think women need to get better at. We need to just say no when the time is no. And this last one, which we learn how to speak the truth in love, we really need to be able to put our big girl underwear on and get out there and say what we mean to say. Hopefully no one in this room has that trouble. Surely we can figure this one out. And then back to the skin. These are 3 pretty cool women to me. My daughter is 14, and her skin is so plump. I cannot even, it's totally wasted on her. She smiles, and there's not a line anywhere. And then by the time I start smiling, there are a couple lines at 43. And then my mom is absolutely amazing. My mom is a wonderful human being, but she stresses quite a bit, and she has passed that gene on to me. And that is why I talk so much about it, because my natural tendency is to stress. And as a family physician, I know that I'm not supposed to do that. I know as a child of God, I'm not supposed to do that. But it just is the human part of us that we do. I had a very wonderful practice when I was in my early 30s, and it was fantastic. It was making me lots of great money, and I had lots of time. But it was so stressful. I was coming home in a bad mood. I was thinking about the next bad thing that was going to happen, and it wasn't depression, it wasn't anxiety, because I was living with a shrink, and he told me it wasn't. It was just stress.